Move this along because some of our speakers need to leave early. Some of them have planes to catch. I do want to thank you all for being here. I'm Carey Meyers from the Rockefeller Foundation, and we're so pleased to be co-hosting this session with UNFCCC's Momentum for Change and also the World Health Organization. I want to share a very brief history lesson that I hope will help you understand why this gathering in this room at this convention is so meaningful to the Rockefeller Foundation. And that is because it was barely 5 years ago in January at an event marking the Foundation's 100 years supporting public health that the term planetary health was coined. And this happened at Peking Union Medical College, and it was a particularly bad day for air quality in Beijing. Visibility at best was about 15 meters. And the event was focused on the future of health. And it was actually Lancet editor Richard Horton who coined this phrase, sort of looking outside and thinking about the future, that it's not possible really for us to think about human health in the absence of thinking about our planet's health as well. And there it was, a powerful new frame for what may be the most pressing health issue of our day. So in less than 5 years, we've moved from a new term and a new focus to this moment, and that feels particularly important, is that we're having a discussion here at a climate conference, not at the World Health Assembly, although certainly we hope to have it there too. And this is thanks to the incredible work of today's speakers and thousands of others. Indeed, the planetary health field represents a number of disciplines and sectors working together. And this is a goal that many have, yet few achieve, especially in so little time. And Executive Secretary Espinosa will be joining us when she's able to. But I really think it's in large part thanks to her leadership and vision to really bring these communities together and represents a model that I hope others will emulate. So with that, I'm actually going to turn this over to our first speaker, Professor Andy Haines from London School of Hygiene and Tropical Medicine.
Well, thank you very much. And can I pay tribute to the Rockefeller Foundation for supporting the work of the commission that I chair, the Planetary Health Commission, and for being really a great exponent of this whole emerging field of planetary health. So the Commission published its report a couple of years ago in the Lancet Medical Journal, and what we tried to do was to distill out this simple definition of planetary health, and we decided that what it really meant was the health of human civilization and the interplay between the health of humans and the state of natural systems on which our health ultimately depends. Well, you could say that's not really new, because after all, Hippocrates was talking in airs, waters, places thousands of years ago about this kind of integrated concept. But I think what is very different today is that we live in a new geological epoch, which has been called by many people, indeed it's now officially known as the Anthropocene epoch. And it's called that because it's characterized by the activities of one species, which dominates the global environment, our species, of course. So it's human activities which are now the driving forces for these multiple environmental changes to which humanity, and indeed the whole of the biosphere, is increasingly exposed. So climate change is why we're here today, and it's probably the most important single trend, as we know, already over 1 degree since pre-industrial times, and hopefully we can keep it below 2 degrees. But there are many other changes as well, deforestation in tropical regions particularly. Water shortages, many parts of the world are depleting their finite freshwater aquifers, and these cannot be replenished on human life scales. We're acidifying the oceans, so as CO2 dissolves in the oceans, that's affecting the pH of the ocean, and that in turn has very wide-ranging implications for marine ecosystems, particularly shellfish, but also fish in general. And of course, about 2 billion people depend on fish for 20% or more of their protein intake, something of that order. And we're also depleting biodiversity, so probably 100-fold, maybe a lot more than that, greater than pre-industrial or pre-human times. So there's these multiplicity of changes which are rapidly emerging and taking over our planet. And the interaction between them and that those trends individually are going to shape the health of humanity over coming decades. Indeed, they're already doing so. There are three broad types of health impacts: direct effects, extreme events, you already heard some of those. Heat itself is an important driving factor of health. Ecosystem-mediated effects like infectious diseases or food supply, and socially mediated effects through increases in poverty, perhaps increases in conflict, violent conflict. I won't obviously have time to touch on all of them, but let me just give you a few very, very brief examples. First of all, the obvious health effect of climate change: increased heat. We know that heat events cause increased death rates. Some heat waves, many thousands of people die. But we also know that increasing heat diminishes the potential of humans to work outdoors. And this slide just illustrates how, as the world gets hotter, at the bottom it's 3 degrees warmer, how it will become progressively more difficult for people to work outdoors. And that will drive more people into poverty, also affect their health. There's an emerging kidney disease now around the world, which particularly affects cane cutters, for example, in Central America and other tropical regions, which is devastating the local economies in some of those rural parts of those countries, and is killing particularly young men, particularly those who work in very labour-intensive industries in the open air without adequate hydration. That's probably contributed to by climate change. So climate change is going to have a big economic effect and a big health effect. Climate variability and change exacerbates food insecurity, particularly those areas that are currently vulnerable to hunger and undernutrition. As shown in this slide, the top side is the impacts of climate change on food productivity, and the bottom shows the overlap with the global hunger index, particularly in terms of sub-Saharan Africa. So those regions which are likely to experience the most hunger, greatest threat of undernutrition, are also threatened by climate change as it evolves over decades to come. And the best estimate we have is probably an extra 500,000 deaths a year by mid-century due to climate change, the effects on crop yield. That's probably an underestimate. But it's not just climate change. This is a slide that Sam Meyers' group developed, some work they published in The Lancet, which looks at the effects of pollinators, losing pollinators like birds, hummingbirds, bees, and butterflies in many parts of the world. And we're losing pollinators for many reasons, probably because we're using too many pesticides, but also because we're taking out a lot of hedges and places where pollinators can thrive. So they estimated that if we lost all pollinators, probably 1.4 million extra deaths due to increased cardiovascular and other non-communicable diseases, because fruit and vegetable consumption, dependent on pollinators, also protect us against these non-communicable diseases, and also malnutrition and communicable diseases, because, for example, vitamin A depends on our intake of pollinated crops. So it's this combination of climate change with these other environmental changes that really poses such severe challenges to human health, nutrition in the future. But also many infectious diseases are affected by environmental change. This just shows you the drivers of recently emerging infectious diseases in humans as they're transmitted from wildlife. And you can see that land use change, food industry changes, climate change, international travel all contribute to the emergence of some of these diseases like Ebola, Nipah virus, a whole range of other emerging infectious diseases which are likely to afflict us with greater intensity and frequency in years to come. So environmental change then affects many, many conditions and through many different pathways. But in trying to come up with potential solutions, the Planetary Health Commission identified 3 overarching challenges which they said had to be addressed in order to provide a positive vision for the future. The first of these was conceptual challenges, or imagination as we also called them. One example of that is equating health with biomedicine. Biomedicine is very important, but it's not sufficient. As we've already heard, unless we can sustain the natural environment on which our health depends, then we will not be able to sustain health, even with improved biomedical interventions. The knowledge gap. Until very recently, until the Rockefeller Foundation and the Wellcome Trust came into the arena, there was very, very little funding to support research in global environmental change. That is slowly changing, but there's still a lot that we don't know, and we need to put far more resources into understanding the pathways by which environment and health are linked and developing solutions. But where we do know what to do, we often don't implement it. And the reason for that may be complex, but one obvious reason is we've got massive vested interests, of course, which have got a great deal of resources, which is basically predicated on the current system of not paying the full economic costs of their activities. And much of the fossil fuel industry we can put in that category, as we heard from Governor Schwarzenegger. So let me give you a few examples in closing of potential policies that could improve planetary health, both improving human health and natural systems. Obviously, the first one is clean energy. This is just one report that came out fairly recently of the International Energy Agency, showing that if we had a small percentage increase in investment in clean energy, we could save over 3 million lives within a couple of decades per annum and provide energy access for all, lowering energy import bills and leading to a peak in CO2 very rapidly. It's not just carbon dioxide mitigation. Coal is very important, of course, but also some of the short-lived climate pollutants like black carbon and methane, for example. So we need to reduce all of these climate-active pollutants at the same time if we're going to keep below 2 degrees and certainly below 1.5 degrees. And they can all bring big health benefits in the near term. The future of planetary health will undoubtedly depend on cities because they are responsible for 85% of the global GDP and about 3/4 of global energy-related greenhouse gas emissions. And this slide just reminds us that the way that we design cities is going to be crucial influencing their environmental footprint. So on the left you have Atlanta, and on the right you have Barcelona, and they have the same population roughly, about 5 million people. They have about 10-fold difference in surface area, over 7,000 square kilometers in the case of Atlanta. And their transport-related greenhouse gas emissions, they're about 20% in Barcelona of what they are in Atlanta. And that's because in Barcelona, it's much easier to use public transport, to walk and cycle, whereas Atlanta, you're largely forced to use the private car. Now, I know Atlanta's trying to change that situation, but they are locked in to much more difficult to change the pathway of development in a sprawling city. So the way in which we design cities or retrofit previous cities is going to be really crucial both for health and climate change. There's a lot that urban leadership can do for planetary health, and we're seeing a lot of activity at the city level through the Compact of Mayors, for example, on efficient public transport, active travel, access to clean energy, safe access to green spaces, and ecosystem strategies for resilience and housing improvements, including water and sanitation. We're also now understanding that protecting ecosystems can yield direct benefits for health. So, for example, forest conservation can reduce disease risks. And this paper is from the work in the Brazilian Amazon, showing that if you conserve forests, you can reduce air pollution, reduce acute respiratory infections, produce cleaner water, because intact ecosystems filter water, filter pathogens, and also decreased malaria transmission. So there are many health benefits from forest conservation in addition to the environmental and greenhouse gas benefits. We've already heard that there are many taxes and subsidies which are driving us in exactly the wrong direction. So about $5 trillion of energy subsidies which subsidize fossil fuels, if you include all the adverse effects on health in those subsidies. And we need to redirect them to much greater investment in low-carbon energy. It's not just, of course, fossil fuels, it's also food, fisheries. Everywhere we look, we find subsidies which are often benefiting the rich and powerful at the expense of the poor and driving us into unsustainable directions. And finally, the food and agriculture system is also quite dysfunctional. It produces very inequitably food which produces overnutrition in some cases, a lot of growing obesity problems, overweight problems, and at the same time there's a residue of undernutrition, nearly 1 billion people suffering from undernutrition. So dysfunctional food system contributing to perhaps 30% of greenhouse gas emissions and also contributing dramatically to loss of biodiversity and water use. So reducing food waste, for example, 30% of our land is used to produce food that's never eaten, it's just wasted. And moving people onto healthy and low impact diets, as illustrated in this slide from a recent review that we've done, would also reduce greenhouse gas emissions, reduce land use, and also water use. So there's a lot we can do by promoting healthy and more sustainable diets. So in conclusion, let me end by saying that we have to have a positive vision for the future. We cannot, as we've already heard, merely alarm people with dramatic stories of how our health is threatened in the future without clearly outlining what potential solutions exist. And we concluded that solutions do indeed lie within reach, and they should be based on the redefinition of prosperity to focus on the enhancement of the quality of life and delivery of improved health for all, together with respect for the integrity of natural systems. And of course, the Sustainable Development Goals, which are illustrated here, offer a great opportunity to do that. Health is a goal in its own right, but health is also impacted upon by achieving many of the other goals, like 7 on clean energy, 11 on sustainable cities, 2 on food and agriculture, and so on. So there are major opportunities ahead. If we can grasp those opportunities, then we can set the world on a much more sustainable trajectory and protect planetary health for today's and future generations. Thank you very much.
Is this on? Can you hear me? Okay. Andy, thank you so much for that overview that I think has been a great stage setter for the conversation we're about to have. I now want to introduce the rest of our panel here. Dr. Maria Neira is the director of the Department of Public Health and Environmental and Social Determinants of Health at the World Health Organization. I have Sudhvir Singh, who's the policy director at the EAT Foundation. Laura Stachel, who started Stachel, started We Care Solar, as well as Mr. Philip Davies, the permanent secretary from Ministry for Health and Medical Services in Fiji. Dr. Neira, I know you have a hard stop, so I'm hoping that you can kick us off by telling us a little bit about your work at WHO, and particularly how you're collaborating across sectors.
Should I? Thank you, and thank you for inviting us to this critical event. You said, tell us about your work at WHO. And let me tell you my work 3 days ago in WHO. I wake up with an email from a colleague who works in New Delhi, and she was sending me a picture of the level of pollution that day in the city. And without any message, just the picture with a number that says 619. And I'm sure that you all know that according to the recommendations of WHO for air quality, you shouldn't exceed 10 micrograms per cubic meter. So 619 was definitely something dramatic. After that, she sent me another picture where you see the city, see the city is too optimistic because in fact you couldn't see the city. We started obviously to activate all of our alerts and thinking about even declaring. Well, you see, this is another natural disaster that is coming here, probably caused by climate change, or somebody who is just an activist and trying to attract our attention. So my point is, the pollution levels were so high that the price of that was paid by the lungs of the people, the brain, and the heart of the people. And this is the argument that we need to really use and to try to influence those policies that are very much needed to change the situation. So I fully agree with Dr. Haines, Sir Haines, when he says that let's be optimistic. I think we had our dose of apocalypse and the reality that it was even paralyzing us. We can't afford any more that. We need to alert the people, but at the same time making sure that action will follow. Action is possible. When you look at the causes of air pollution in New Delhi today, one of the causes was the fact that they were doing incineration of the agricultural crop. So you need to do something about that. Obviously, it's not as easy as it looks like because there are farmers that are surviving on this type of approaches, and you need to look at compensations, and you need to make sure that you are not penalizing those who are already very poor, and in order to reduce the air pollution, but you need to tackle that. Second, you need to look at the city level in New Delhi. which type of cars do you have in circulation? Do you have a public transport system that is not polluting? Which type of heating and cooling system you have at the household level? Which type of energy efficient policies you have? Which type of cars? Do you still have diesel cars that are circulating? Which type of policies you have for planning your cities and working with mayors and others to look at workers' health as well, the protection of those who are working outside and under the heat stress. And this is public health, and this is public health at the best. And this is why WHO wants to be very much represented here with your voice on health, on saying that we are at the COP, because at the COP is where certain decisions about transport, about agricultural production, about use of fuels, clean or non-clean fossil fuels, about all the policies that we need to put in place to protect our human health from the causes of climate change are taken. And our voice has to be very powerful, based on evidence that we have it, but based as well on very good and positive and action-oriented recommendations for interventions that I think we can, at the moment, put in place. I don't know how many of you were here at the previous session with, when Arnold Schwarzenegger was saying that from now on any document of the United Nations talking about climate change, by law, should be accompanied by one page describing the health risk associated with not taking action. So I think health can be the big change that we were all waiting for many years. Health can be what will make the connection between the planetary health and the reality of the people every day. Health can be the reason why, from now on we will move on a sustainable development on a natural way, and not because from a political point of view we were convinced, or not because the science was convincing us, but because this is the only way to go. And if we can create that movement with any of you and the youth and the policymakers and everybody represented here today, this all will be so natural and so logical that it will make a lot of sense. We need to connect people with the reality by telling them that this is about asthma. This is about diseases. And this is about whether or not you can walk on the city where you live. By the way, Andy, Barcelona has a very good public transport system in normal circumstances. Today, with the strikes and things like that, I'm afraid it's not anymore the case. But this is a ad hoc political situation. I hope it will change soon. Anyway, so I call on all of you on thinking on all of this spectrum, whether and when we can have our own impact, whether it's at the medical school, or whether it's at the academic world, or it's as a youth, or it's at home, or it's by working at the World Health Organization. I think this is the moment now to start to move on a completely different speed, a positive one, and push for what is natural. And the public health community saw it before, but we need now to make sure that others don't keep to be blind as they have been until now. Thank you.
Thank you.
I don't know whether this answered your question. Probably not.
It's a great start. Actually, since you are the first of our panelists who have to leave, I would love for you to say a little bit more. You talked about optimism. You've talked about hope. Where are you seeing progress, and what gives you hope?
Okay. I see progress on the scientific evidence, thanks to the work of the Rockefeller, the Lancet Commission, any of the scientists that are here. I think that we have a very strong evidence. So I see definitely a signal for optimism there. The countdown, the Lancet, the work that WHO has been trying to do with others and raising awareness about that. I see optimism on the connection with mayors or some national governments, because they are the ones who can take intersectorial action, and they are the ones that see the connection between the actions they are taking, the health of the people, and the political return, the positive political return that they might have. I see optimism on the sustainable food production, because people start to understand that this starts on the field and it goes until we reduce reduce the waste, the food waste that we are generating at the moment. I see optimism in WHO because our new Director General has declared climate change and environmental change as one of his 4 priorities. So hopefully this will be moving on a different sense. And I see optimism because many of the politicians represented here today, they don't talk anymore about climate change as if it was a political or a religion. If you are from the right wing, you don't believe on climate change, and if you are from the left wing, you believe on climate change. This is not a question of belief or a religion approach or whether or not I am convinced. This is a question of protecting the health of the people, promoting a more sustainable and economic development. We have plenty of examples at the moment, and I think another reason for optimism, I see it in China. I see a lot of optimism coming from China. China is taking incredible measures now on the name of health, on the name of the economic development that they want to put in place. So if we can see optimism coming from China, I think we can be optimistic.
Thank you. Sudhvir, you're the policy director at EAT, and it has a bold ambition of reforming the global food system, but really looking at how to feed 9 billion people with healthy food from a healthy planet. What are some of the challenges that you're seeing in changing people's habits? What do you find actually motivates people?
Yeah, thank you very much. And first of all, I just want to thank the Rockefeller Foundation for supporting not just this event, but this thematic topic more broadly, and momentum for change for this event as well. So I think, so Andy's touched on it, but the food system, I think, exemplifies some of the challenges we talk about when we think about planetary health, because not only is the way we're producing food fundamentally altering our planet, potentially in an irreversible way, not just through climate change, but also through some of the other metrics that Andy used, such as land use, biodiversity, water. But on the human health side, diet, what we eat, is the biggest risk factor for ill health globally, according to the global burden of disease. We have this incredible contrast where we have over 800 million people in the world going to bed hungry, and yet 2 billion now suffering from overnutrition, obesity, and that's driving this huge epidemic of non-communicable diseases that many of us from a health background are quite familiar with. But these two sides of the coin are actually the same coin, because they're linked. Just last month, the report was released by the UN showing that for the first time in many years, global hunger is actually going up in addition to the rise of obesity, and that's being driven by climate change. So we're seeing these circular patterns, and likewise, some of the planetary health research is telling us that as temperatures go up, some of our staple crops, not only will we have reduced yields, but the actual nutritional quality of these crops will go down. So in summary, this is an enormous, complex systems challenge. And to make progress, what we need is to actually break out of our silos, because many of us are seeing these issues through the lens of our profession. So I'm a health guy, so I see it mainly through that NCD's perspective. But fundamentally, we need health, agriculture, environment, finance, all looking at one problem with a common definition. So that's the first thing we need to overcome, is actually coming up with a common definition of what is healthy and sustainable food. And EAT, we're pulling together a follow-up commission to the Rockefeller Planetary Health Commission to help try and do that. But then on the consumer side, there's a lot of confusion as well. And what motivates consumers? Well, it's taste, it's price, and it's convenience. And none of those things include the words planet or health. So whatever solutions we come up with at a sort of technical level, we need to actually translate into what an ordinary person can actually incorporate into their lives. And that means altering the food environment, the choices that people are exposed to, but it also means really playing on the role of celebrities and the role of, say, chefs in our society. So how can we make healthy and sustainable food actually tasty and attractive? And unless we do that, unfortunately, we're not going to shift the dial, because planetary health in itself isn't a major motivator.
Thank you. Mr. Davies, as a government leader, you have your finger on the pulse of health trends and data for your nation of more than 900,000 people. Have you seen any major changes lately that you think climate might account for?
Undoubtedly, yes. I mean, anyone who was in the previous session, I think, would have heard at least 3 references to the severe tropical cyclone Winston, which hit Fiji last year. Biggest such event ever recorded in the Pacific. Took 40 lives and caused massive damage to infrastructure, including health infrastructure. Something like 27% of NCD deaths, broadly defined, are attributable to pollution in Fiji. We know every year when we have about this time of year, it starts raining and it seems never to stop. But every year we see rivers rising, and there will be people who drown trying to cross rivers to go about their normal daily business, and that will only get worse. I think there's an estimate that, you know, the number of people exposed to flooding will increase greatly. So clearly these things are happening and can't be ignored. And I think, again, anyone who's in the previous session will have heard that, you know, the Pacific really is, there's many people probably heard the expression the canary in the coal mine. You know, the Pacific, I think, when it comes to climate change, probably is the canary in the coal mine. And we're seeing now what other parts of the world will see in 10, 20 years' time. So I think that's why we become a little bit vociferous in putting forward our case. Having said that, however, you know, I think I'm probably alone on this panel, and probably many of the panels, in that actually my day-to-day work is about running a health system. And I suppose I would ask others to try and walk in my shoes and think, well, you know, what does planetary health mean to me? What can I do? What should I do as a mere bureaucrat to actually respond to the planetary health agenda? I mean, there can be no doubt that it's a significant issue. We've got the data, but how do we actually translate that into real, tangible policy actions? And you know, I almost wonder whether I struggle to identify what I should be doing to respond. And I wonder whether it's almost a case of redesigning how we even think about government. And that sounds like a very broad agenda. But I'm now working for my 4th health administration. And a good example, when I look across all those areas where I've worked, rich and less well-resourced, you know, we're really bad at dealing with mental health. Health systems are really bad at dealing with mental health. And then when I try and deconstruct that and I think why, it's because actually mental health problems, to resolve them, to address them, you've got to act on housing, you've got to act on employment, and you've got to act on health. And we can't do that. Governments are not equipped to act on those multidimensional, multi-sectoral measures. And even closer to home, you know, NCDs, we've heard about NCDs. We all know the social determinants, the factors that drive NCDs. Most of them are outside the health sector, and we're really bad at dealing with them. So given all that, when you cast an even broader to the scale and scope of planetary health, I'm really not sure that government as we know it is fit for purpose to deal with these issues. It almost, to take a rather convoluted medical analogy, but come with me on this, it's almost as if we've got the diagnosis, we've done the diagnosis, we know what's ailing the patient, we know the treatment, or at least some parts of the treatment from a policy perspective. The problem now is about persuading the patient, and the patient in this case is a mixture of individuals, governments and private sector players. We've done the diagnosis, we've prescribed the treatment, but how do we actually get the patient to comply with the treatment, to willingly participate in administering the cure? There was a phrase on the presentation about redefining prosperity. Well, you know, to be honest, we can't sit here in Bonn and redefine prosperity. I've got to persuade 900,000 people in Fiji to redefine prosperity, and that's very difficult. So we are feeling the impacts, but clearly, you know, is it the classic case of the burning platform that people won't respond to these issues until they see more directly the consequences of not responding? So I guess the challenge I put out to the panel, to the audience, is really, you know, how do we move from analysis to action? How do we incentivize governments, but ultimately the individuals who elect governments in most countries? How do we incentivize those people to come with us on this journey? Because until we can do that, I think we're talking in a bit of a vacuum.
Yeah. Would any of our panelists like to address that? I thought you might.
Well, clearly you've articulated sort of major challenge, and there's no simple answer. But I think one of the issues is that at the moment our economy is set up in a way where very powerful interests don't pay the full economic costs of their activities. Indeed, their business models are set up to not to pay the full economic costs. So sooner or later, I think as Governor Schwarzenegger indicated, those special interests have to be confronted, and we have to take back the initiative and ensure that these full costs are paid. So we need to transform the tax systems, and I think that is a political task, to remove some of these damaging subsidies, which usually anyway benefit a privileged group of people in society and not the people who are actually suffering the brunt of climate and other environmental changes. But also we need to reorient the tax system so that it's directed much more towards things like carbon pricing. Some taxes we have are regressive. In other words, poor people pay more proportionally than rich people, whereas carbon taxes could be designed to be much more progressive. So I think if you take it as a broad, cross-cutting agenda, then I think there is a really important role for government in terms of regulation, in terms of tax, and in terms of setting the broad framework within which planetary health can operate. And let me just say, in terms of the health system, I think the health system does have a very important role. In some countries, in the US, for example, the health system is responsible for about 10% of greenhouse gas emissions, if you look at the whole system. In the UK, it's about 3%. And very large numbers of people work in the health system, and they're very influential. So if you get them to start thinking about this planetary health concept and start talking about it, they can have a big effect through their social networks and through talking to patients about lifestyle changes which can improve their health and the health of their family, but also reduce environmental impact. So I think there's a lot that can be done. I don't want to minimize the problems, and I accept what you're saying, but I think there is quite a few things, concrete things that can be done once you reframe government policy to look in this broad planetary health lens.
Your comment about how the health system itself can change is a really good segue to Laura, who has brought solar light to more than 2,500 healthcare units across Africa and Asia that the grid has yet to reach in support of safe delivery of babies. And you've demonstrated that you can support human health with absolutely minimal environmental impact. What else can be done? I mean, it's such a great opening. Andy has just indicated that a tremendous amount of environmental impact is generated by the health system, and you have an innovation that can fix that.
Hi. Well, thank you so much for having me here. I think it's kind of interesting that as an obstetrician, in my training, I don't think I ever would have imagined that I'd be speaking at a climate change conference. Yet, for those of us working particularly in the developing world, it's really important to be wearing a number of different hats, because I think health is really multi-sectorial. And the way I got on this journey was as an obstetrician trying to understand some of the factors that were leading to maternal mortality. Around the world, 300,000 women die every year from complications of pregnancy and childbirth, and about 1 million newborns also die during that same time interval. And when I went to study what was happening in hospitals, for example, in Nigeria, what I saw was that health workers were trying to save lives having something like this for lighting. This is a kerosene lantern. In addition to providing very poor quality of light, it also creates smoke, it's health hazards, it's air pollution, and yet this was the very first air quality that newborns were being exposed to as they were coming out of their mother's wombs. And healthcare workers couldn't do their job with this type of lighting. Imagine trying to deliver a baby who's trying to gasp for air and trying to provide a procedure to help resuscitate that newborn. Imagine what it was like for me as an obstetrician accompanying other doctors doing C-sections. The lights went out and there was literally no light in the room because of an issue that plagues much of the world: energy poverty, sporadic electricity supply because grid electricity is not adequate. And so people use things like diesel fuel generators, they use kerosene lanterns, they use candles, and they're really struggling to provide life-saving care. So when faced with that problem, I actually consulted with my husband, who was a solar innovator, and he came up with the idea that we could create a solar electric system to try and support healthcare in this one large hospital in Nigeria at which I was working. And we tried to target the areas that we thought would be most important for maternal health care. So we brought in solar power for the delivery room. We brought in a solar-powered blood bank refrigerator to treat hemorrhage. We brought in solar power to the operating theater. This hospital was losing 3 to 8 mothers every month from complications of childbirth. When we did the intervention I described to you, the deaths went down by 70% in the next year. And at nighttime, the hospital was no longer turning away women who arrived with complications because there was no light to even see them. And so one of the things it allows us to think about is that as we identify problems in the health sector, we can start thinking about what would be solutions that are also good for our planet. By bringing in solar electricity, and the reason I touched this box is because after we helped the big hospital, we got requests first from many health centers around the large one asking for solar electricity. They said, we're clinics, we're also working in the dark. And then after a New York Times article described what we were doing, we began to get requests from around the world. And so we developed something called a solar suitcase. There's everything in this box: solar panels, a battery charge controller, medical quality lights, a fetal monitor, phone charging so health workers can call for help rather than running around a facility looking for a person to try and help with an emergency procedure. All of that fits in this box, and it can get anywhere in the world where there's sunlight. And what we're finding is that we've been able to support hundreds and hundreds of health centers that were otherwise cut off from reliable electricity. And in addition to health centers that are on inadequate grids, we found that there are lots of humanitarian disasters that also pose tremendous health risks. Ebola. Imagine being in Liberia and Sierra Leone, trying to take care of patients, trying to figure out who has Ebola, and having a health center with no light. So we brought these to Liberia and Sierra Leone. Imagine after typhoons in the Philippines, where health workers were cut off from power, or in Nepal after earthquakes, where health workers were still needing to care for 26,000 pregnant women, yet they had no reliable electricity. So thinking about something that is robust, high quality, providing solar electricity or other renewable energy sources is going to help our health systems to be more effective and more resilient, especially in the face of all the climate changes going on. And I'll be happy afterwards to show anybody what's in the box.
I was just struck by that example and the earlier comment about, you know, the fact that it's our health services are major employers, they are major contributors, they're major components of our economies, they're also major contributors probably to greenhouse gases. And we are currently in Fiji, we're working on developing green health facilities, which is supported by Korea. Which is a great initiative. But there was also another example in the same vein as the solar suitcase, which is like a win-win in terms of oxygen. So we've got about 100 health centres dotted around 100 inhabited islands, and we try to keep them all supplied with oxygen. And that is done by trucks loaded with big cylinders that may or may not arrive when they run out of oxygen. We're now working with a group from New Zealand who have actually developed a solar-powered oxygen concentrator. So that has, the reason I describe it as a win-win is it's a more reliable supply of oxygen because the tank doesn't run out, but it also saves all the environmental impact of trucks driving around laden with heavy metal cylinders containing ultimately a gas that weighs next to nothing. So again, I think there's a good example alongside what we've just heard of how actions in the health sector itself can have that sort of multiplier effect.
That's incredibly inspiring, and I appreciate the added note of optimism. What's giving you optimism these days, Sudhvir?
Yeah, that's a good question. I think what's giving me optimism, for example, was yesterday there was a climate and health summit where the health community, including many in the room here, convened to actually discuss practically what they can do to actually advance some of these examples that you've just provided. Noting that health sector alone, I think, is responsible for 5% of global greenhouse gas emissions already. So I think there is some really strong momentum within professions to start incorporating these principles. But I think I really liked the sort of existential challenge that the health secretary sort of provided earlier about this sort of discussion in Bonn and the real world. And I think it sort of gets to the core of the matter. And to address that, we need multiple things, because this is a very complex problem. We need action at multiple levels. I think we need the common definitions, the data, the true cost accounting that Sir Andy mentioned. We need the professions to start doing what they can, like we've talked about within health. But then what I find perhaps most challenging is actually speaking other sectors' languages. And I don't think as a health community we've actually nailed that yet. I think the sort of health and all policies framework is quite top down. It's sort of like, we know about human well-being, so we know best. But ultimately, other sectors are driven by their own incentives. They've got their own languages, they've got their own things to do. And I think, over time, we want them to naturally put weight on environmental and health implications without people coming up to them and saying, you need to take this seriously. And that requires a process. And to start that process, I think those of us in the health community need to actually just spend some time, some genuine time, and listen to other sectors, find out what drives them, find out what language they speak, and then identify some entry points for change, rather than just saying health and all policies, prioritize planetary health, etc.
Yeah, one thing I can add to that is another initiative that the Rockefeller Foundation is supporting right now is actually a Planetary Health Economic Council that's based at Oxford Martin and led by former Mexican President Ernesto Zedillo, that's really looking to make the economic case for why you should take a planetary health approach to building business plans, to developing government policy, and trying to understand from the beginning what the likely health impacts would be of choice A versus choice B, and to really cost that out, and to get that done up front, so that there aren't false choices being made.
Yeah, I just want to echo a little bit about what you were saying. What we're trying to do now is actually work at the government ministerial level to try and get policies. So, for example, we have an initiative called Light Every Birth. I mean, we're a nonprofit in Berkeley, California. And why are we, as this little agency, trying to work on something? It's because there's been huge gaps between the energy and the health sector, and something like maternal health facilities getting reliable light fell through that gap. And we're trying to elevate the issue and say this is something that you can be doing at a countrywide level. And we're calling this initiative Light Every Birth. We're calling upon governments to partner with us, to partner with other colleagues to try and ensure that there's renewable energy throughout health, but throughout health facilities. But right now it's been very challenging, as you say, because you have these, silos between the energy and the health and the finance ministries. And so we need to think about how do we change the incentives and really encourage more of this intersectorial partnerships. We talk about private-public partnerships, but even within countries, and maybe you can speak to this more, how do we get these different agencies to work together so we're not playing people off each other and having people work from a sense of scarcity so no one wants to take the step to do some of these more bold moves?
Andy, I was looking at you a moment ago because I understand you were recently at the Pontifical Academy of Sciences meeting. And that led to a declaration, another declaration by Pope Francis on climate change, air pollution, and health. Can you briefly summarize that and what impacts that might have?
Yeah, thanks very much. Well, I mean, obviously declarations in themselves have a limited impact, but at the same time, I think it is really important when key global figures do make these declarations that can influence the thoughts and behavior of so many people. So this particular meeting was, as you say, it was bringing together scientists from a range of different backgrounds with political leaders. So Governor Jerry Brown was there. We had Senator De Leon, who's at the moment the chair of the president of the California Senate, together with a whole range of health researchers and health professionals. And it was quite an inspirational meeting, I have to say. And some of the headline messages that came out of it was how health must be central to the policies that stabilize climate change. So very much the message we've talked about in the last few hours. We heard from California, for example, how they're aiming to decarbonize the whole economy by 2045. So that is a dramatic initiative. And if every country were to do that, then we would be pretty well all the way to 2 degrees, maybe even below 2 degrees. So that was inspirational and shows us that whatever might be happening at national levels in the US, there's a lot of activity at the subnational level. And indeed, when one looks around, I think it's a lot of these subnational activities at the level of individual cities or states or provinces that really give one a cause for optimism. So the other sort of headline messages that came out of the meeting were really the importance of forging new collaborations between the scientific community, the health community, faith leaders, civil society organizations to try to develop a movement which isn't just top-down, because I agree with you, we can't just have a top-down movement, but it needs to be the combination of the bottom-up movements, the kind of work you've been talking about, with the kind of top-down influence of policymakers at different levels. So I think the subsequent declaration or the statement that the Pope made, I think, was a very powerful one. It linked air pollution and climate change and the impacts of human health. But interesting enough, in his final sentence of what he said was very interesting, because he reminded us that technology, he says, which linked to business interest, is presented as the only way of solving these problems. In other words, the only way of solving climate change and air pollution. In fact, proves incapable of seeing the mysterious network of relations between things, and so sometimes solves only one problem only to create others. So as I understood what he was saying, he's saying technology is important, we shouldn't neglect it, but we also need to think about values and about how we live our lives and about thinking about future generations as well, because the way in which we're transforming the global landscape and the greenhouse gases we're putting up in the atmosphere, 20% of CO2 is going to be up there for 1,000 years or more. So it is a legacy that we're leaving future generations. So technology is important, values are important, and the way we live is very important.
Thank you. We have about 15 minutes left. Do any of you who've joined us have questions for our panelists?
Thank you. Hello, Judy Saul here from Mother Channel Internet Television and Cape Town TV, which is the Southern African satellite. My question to you is, I interviewed Tim Noakes recently. He's fairly well known for his belief that the diabetes is going to become the worst epidemic this planet's ever had, mostly because we eat the incorrect food. And considering that, and also that a lot of the cancers and even the genetically modified food which causes leaky gut, which transposes to humans and creates all these food intolerances, all of these things mean that potentially we shouldn't be eating as much grain as we're eating, and certainly that the diet could control everything. We're just about to face a future with very difficult growing conditions, and we need to think as people who are choosing, as health professionals who are choosing what our population could eat for the maximum health, how we could choose a system of feeding that would eliminate the genetically modified and the high carbohydrate meals, and bring about some kind of resistance back into people because they're eating organic food. But is there any place in any of the schemes of any of the people that we're talking about, that the health schemes that you know about, that even thinks of starting to address the health problems at source, which is to maybe get banned or something. The food, there's so many foods that are containing the things that you poor health professionals are having to deal with, and which are straining our planet. And we might be able to support the feeding of our planet even in drought conditions if we didn't start, if we chose carefully what we produce.
I think you've just opened a few cans of worms, to be frank. You've mentioned organic, you've mentioned GMOs, microbiome. That's a whole other story. But I guess it's very difficult to answer your question in a simple way. But I think this highlights some of the complexity out there and the uncertainty that consumers have in knowing what is actually healthy, let alone what is sustainable. And that's why I think, first of all, there's a genuine research question there about what is healthy and sustainable, how do we measure that, and then how do we actually take action on that and incorporate that into, say, for example, national dietary guidelines. I think we need these kind of peer-reviewed, implementable guidelines that will actually be sort of locally relevant and incorporate cultural interests, but also be quite clear about, as authorities, as experts, we're saying this is what's healthy and what's sustainable, and here are the steps that we'll be taking to ensure that you as a consumer can access this type of food. And I think it's really pulling information together and synthesizing is one of the best ways of trying to overcome some of that confusion.
Yeah, I think you have raised some really important issues, and a couple of things I would say. First of all, diet is obviously very, very important in terms of human health and obesity, but we mustn't forget physical exercise as well. And populations are burning fewer calories than ever. So we have very sedentary lifestyles. Sedentary lifestyles themselves are extremely damaging. So it's a combination of diet and inadequate physical activity. We need to think about redesigning our physical spaces, redesigning our cities to support healthy physical activity as well as improved diets. You mentioned organic food, which is a controversial area, and people have very strong views about it. My own view is, I'm very sympathetic in some ways to organic food, but I doubt it's not a panacea. Because, recent data shows it would be very difficult to feed 10 billion on organic food alone, at least given current technologies. If we invested more in research in organic food, maybe we could get better yields. GMOs, again, it's a complex area. My take on this, and I'm not a specialist in the area, is that the issue is not so much the technology, it's the control of the technology. It depends what you're doing with the gene, what you're modifying it for. If you're modifying a gene to create drought-resistant crops, that could be a very good thing. If it's controlled, if the genetic modification is controlled by special interests that are more determined to create more profits than to satisfy the need for healthier food, then that can be a problem. So to me, it seems an issue of the control of the technology as much as the technology itself.
Just while we're on food, just one little anecdote at my own expense concerning salt. The average Fijian's salt intake is double the WHO recommended maximum. I was speaking recently at a conference on salt in Fiji, and of course there's a Q&A like this, and from the floor came the very sensible recommendation, we should put a tax on salt, which I thought was a great idea. Note to self, increase the tax on salt. And then someone else in the audience pointed out that actually salt is on the list of foods in Fiji that is price controlled to make sure that it's affordable. So there's a perfect example of non-joined up thinking on the part of government. For the health point of view, we should increase the price of salt, but in terms of affordability, it's put on the list of foodstuffs where the retail price is controlled. Needless to say, I've written to the Commerce Commission saying we should take the price control off salt. We'll see how that develops.
I understand that the Executive Secretary is soon to arrive, so we'll take one more question, which we may interrupt the answer. In the back. Yep.
I'm Anke Rasper. I'm with Deutsche Welle, the public radio station up here, which is the BBC of Germany. My question is, there are about 1 billion people in the world threatened by neglected tropical diseases at the moment, NTDs, and the WHO is stepping up momentum. There are several initiatives. Where in the planetary health agenda do we find them? Because we know that diseases that are vector-borne, that are waterborne, like dengue, are expanding with the climate changing. So what's the platform for NTDs in this?
Well, I mean, just before coming here, a few weeks before coming here, we had a conference of our Society of Tropical Medicine where we talked about planetary health, and we had a number of speakers who were talking about the interlinkages between some of these neglected tropical diseases and the environment. I think it's true to say at the moment, one of the major drivers, of course, is poverty, and the environment is also playing a role. But as climate change bites, that's going to force probably more people into poverty, and so it'll make them more susceptible to diseases. And indeed, a number of you say dengue. I agree with you. Dengue is increasing. Climate change is probably playing a part of that. Recent evidence has shown that actually the capacity of the key vector mosquitoes to transmit dengue has increased over recent decades, and that's probably partly due to climate change. So there are all sorts of interlinkages, and the danger is that climate change and other environmental changes may actually reverse the progress we've seen in health over recent decades by actually undermining the basis of our health, including potentially pushing more people into poverty and increasing their vulnerability to some of these neglected diseases.
Just very quickly, I think what this agenda calls for is to actually tell stories and give concrete examples of what we mean by planetary health. And I think, you speak about tropical diseases, and I think one example that I think sort of hits a lot of the themes that we want to touch on through planetary health is through, very sophisticated ways of using development assistance. And one example from Norway is during the height of the Ebola epidemic in Liberia. In addition to funding the sort of emergency healthcare services and providing the health system itself with support, Norway actually redirected funding to reforestation in Liberia to promote the habitat of bats, with bats being one of the main transmitters of Ebola, with Ebola being one of the incentives for that, and obviously in turn reforestation offers a sequelae of environmental benefits from being a carbon sink to biodiversity, etc. And I think it'll be interesting. I haven't seen metrics of whether that was successful. I'm not sure if you have, Sir Andy, but I think that kind of broad, interlinked, joined-up thinking are the kind of progressive examples we need to see and catalogue. And that's why it's so great that Momentum for Change, hopefully at the end we'll see some more concrete examples, can actually put forward some demonstrations for what we're talking about by the concept of planetary health.
Another question?
Thanks a lot, Peter Sainsbury from Australia. I was taken by your cri de coeur, Philip Davis, and I was struck by the 4 answers, in effect, that happened. It was suggested that we change the structure and system of government. It was suggested that maybe the structure and system of government's okay, we need to tackle vested interests and change the policies. It was suggested we needed better technology, and it was suggested we needed better democracy. What wasn't tackled was the economy. I mean, it's highly plausible that the market does not contain the solution to the current problem. And so unless we tackle that issue of looking seriously at whether, not just economic liberalism, but capitalism as an economic structure is a tool that can deliver what we're looking for, then I think we're limiting ourselves in the answers we're looking at. So I was just struck by the range of answers, and that no one mentioned looking at the fundamental structure of the economy of the world.
Thank you. I see that the Executive Secretary has arrived.
Hello. Hi. So good to see you. Nice to see you. I apologize.
When I opened this session earlier, called out the leadership and vision you've had in really bringing the health conversation to COP and within UNFCCC. So thank you. Again. Please, yes.
Thank you. Thank you all very much for being here. And, you know, I have to say that when we started talking about health, immediately we got this incredible support by the Director General of the World Health Organization. And then I started looking at what he was doing there, and I realized that, in fact, in his candidacy, in promoting his candidacy, he made of the issue of health and climate change one of the main points. So I'm very, very grateful to him. And I think that what we are doing together with the World Health Organization is also a very positive development in terms of how the UN system can come together, join forces for issues that are so relevant for humankind. And we can, as a multilateral system, deliver in a better way. So I'm very grateful also to be able to join you this afternoon for the closing of this special event. And I want to thank our partners, the World Health Organization and the Rockefeller Foundation, where I also already almost a year ago started exchanging views with the Rockefeller Foundation on this very important topic. So I come here and I come to the COP and I walk through the different corridors here. And what I see is people that have come from all corners of the globe and have gathered here in Bonn with one purpose, which is to participate in the collective search of solutions to challenges that affect all of humanity. So I think it's important to remember how truly remarkable this is. When we come here and we exchange among ourselves, you exchange with your colleagues and friends, and you feel like everybody is doing the same. It feels like, you know, this is what the world is doing. And unfortunately, it's not. It's not. You are part of a very small group of people that are dedicating efforts, dedicating resources, dedicating their lives to very important agendas. And it is also true that today humanity is as mobile as never before. It is connected, it is socially aware, and humanity today, I would say, has the tools to affect change, like we are doing right now. So the connectivity has helped people around the world to address some big interlinked challenges. For instance, life expectancy has increased more than 20 years in the past half century. It has created other problems. People living longer has also created other challenges, but the life expectancy has grown. The death rates in children under 5 have also decreased in a very significant manner. The total number of people living in extreme poverty has fallen. Of course, 105, all of that is too many, but the reality is that we have to recognize that the numbers have fallen. But we have neglected other connections that allowed us to advance to this point, connections that were instinctual to our ancestors. And that's what we are discussing here. We are here because we must reestablish the idea that the health of humankind is intricately connected to the health of the overall environment and with other living beings. It seems like a basic fundamental idea, but one that we seem to have forgotten. Our use and abuse of natural resources has had severely negative impacts for people throughout the world. For example, pollution from fires and the combustion of fossil fuels and solid fuels is resulting in respiratory diseases and millions of deaths, especially children. Overfishing and warming and acidification of water bodies are disrupting coral reefs and fish supplies, resulting in food insecurity, disease, and poverty. Extreme weather events related to climate change, as we have recently seen in all parts of the world, are also a significant cause of illness and death, and have, by the way, consequences for many, many months and sometimes years after they have occurred. Carbon dioxide emissions caused by human activity are reducing the nutritional content of crops such as wheat, rice, barley, and soy. This puts hundreds of millions of people, especially those living in Africa and South Asia, at risk of vitamin deficiencies. So if we are to correct the course we are currently on, we need a broader view of health, one that directly connects human and animal health with the health of the planet. If we take this view, we can improve the lives of individuals, families, and communities around the world, today and in the future. And we will support the achievement of the Sustainable Development Goals and the Paris Agreement, both of which recognize the importance of regional and global coordination to solve complex challenges. For this idea of planetary health to be truly effective, however, we need everyone to do their part. We need researchers to develop further evidence on the health effects of environmental change. We need health professionals to educate communities about those changes and advocate for policies that integrate health care and environmental care at the primary level. We need multilateral institutions, such as the UN, the World Bank, the IMF, to help in a variety of ways. This includes monitoring planetary health and advocating for reforms of tax, subsidy, and trade policies that support planetary health. We need national governments to use evidence-based policies to promote human health and prosperity, while at the same time preserving the environment. We need the business community to demonstrate leadership by doing a better job with respect to sustainability and promoting reform throughout the global economy. And of course, we need civil society organizations to develop broad-based public movements for social change. UN Climate Change is working on the issue of planetary health in several ways, including our Momentum for Change initiative. Momentum for Change, which is hosting today's event, shines a light on some of the most innovative, scalable, and practical examples of what people across the globe are doing to combat climate change. We call these examples lighthouse activities, and they're a big part of our wider efforts to mobilize action and ambition as national governments work toward implementing the Paris Agreement and the Sustainable Development Goals. We are pleased to have representatives from one of those activities here today. Their project is called We Care Solar, and it saves lives in childbirth by bringing solar power to remote, off-grid, under-resourced medical centers throughout Africa. How? With compact, rugged, and immediately operational solar suitcases. These suitcases provide power for medical lighting, essential electricity, and fetal monitoring for essential obstetric care. We Care Solar has reached more than 2,400 health facilities, and it's an initiative that saves lives. Health workers no longer struggle to provide life-saving care with inadequate and dangerous lighting, such as kerosene lanterns, candles, and diesel fuel generators. This also significantly improves the health of the women giving birth as well as their children. This is just one example of this year's 19 innovative and inspiring Momentum for Change lighthouse activities. I am truly excited about these projects, and I encourage you to discover more of them on our website and also in our stand, which is downstairs when you enter the Bond Zone to the left. You will find our Momentum for Change stand. So, dear friends, ladies and gentlemen, the simple fact is we are only as healthy as our planet. By working together to reconnect what was once instinctual to our ancestors, to truly understand our role in the delicate, interwoven web of life, we have the potential to not only build a healthier planet, but a planet that is greener and cleaner for all. Once again, I want to thank the Rockefeller Foundation for its generous support for this initiative, and I encourage you all to continue working in this very exciting and necessary transformation. Thank you very much.
Thank you so much. And that is a perfect segue into our finale, which is a film narrated by Dr. Jane Goodall that profiles all 4 of the Lighthouse activities related to planetary health, including Laura's project. So could you roll the film, please?
Livelihoods flourish when both people and the planet are healthy. Human health and the health of our planet are deeply connected. That's why acting on climate change also means cleaner air, fewer heat waves, and limiting the spread of disease. Communities, businesses, and other organizations are creating real solutions that balance the need for both human health and a healthy planet. No woman should die giving life. In various countries across Africa, solar suitcases are bringing much-needed clean energy to remote, off-grid medical centers.
The solar suitcase is a complete renewable energy kit. It includes solar panels, a battery, a charge controller, medical quality lights, a fetal monitor to listen to a baby's heartbeat, phone charging, and headlamps. They're replacing candles, kerosene lanterns, and diesel fuel generators. It allows healthcare workers to provide life-saving care throughout the night. We promote women as solar technicians so that women become the change makers as well as the beneficiaries.
Most of the time, I crash harder in the night because of the current system are here. But I think the way the solar plate is coming, it will really improve my work.
Light is one of the key components to ensure that we have mothers giving birth in a safe environment.
Our programs were designed for replicability. We're showing that it's possible to bring the first 100 watts of electricity to last-mile health centers around the world.
In Haiti and Southeast Asia, people bring plastic to recycling markets in exchange for critical essentials. Removing this plastic from the environment results in many benefits, including stopping the spread of tropical diseases.
The problem with the pollution in Haiti is that people doesn't understand the value of the plastic, and they don't realize that when they have the plastic in their hands, that it's money. So where the plastic bank comes in is they can bring these plastic into these centers and they can get cash right away for it.
M'ta fait jardin, m'vinn wè jardin pa bon moi la plutôt trop sous le gaspiller, m'vinn plastique là parce que moi l'album moi manik semble plastique manik bail.
In Russia, one of the largest ecosystem restoration projects is underway for dried peatlands. Healthy peatlands reduce the risk of fires and limit the amount of smog in the air.
In dry conditions, peatlands are vulnerable to fire. and it can burn for years. But the fire is not only the risk of the dry peat.
Destroyed peatlands, even they are not under use, they are emitting a lot of carbon dioxide, as well as emitting methane very actively. Drained peatlands are responsible of over 5% of all anthropogenic emissions.
Главная задача – это уменьшить сток с болота, перекрывая каналы перемычками, для того, чтобы торф приобрел естественную влажность и перестал быть опасным. В настоящий момент мы уже обводнили примерно около 10 тысяч гектар, и значительную часть этих гектар мы сделали благодаря российско-германскому проекту по восстановлению болот в России.
The German colleagues from Greifswald University and Zucker Foundation brought us the expertise how to make the ecological restoration. They're vetting targeted the natural ecosystem using the natural materials, the approaches and methodologies, which gives you possibility really to restore natural peatland and all related ecosystem services.
Volunteers are clearing plastic from beaches in the United Kingdom and France, which is recycled into shampoo bottles.
The concept of storied plastics that we pioneered at TerraCycle are plastics where you really understand where they came from, and those genesises are incredibly meaningful. 25% of the world's waste ends up in our marine system, in our oceans, lakes, rivers, and beaches. And in partnership with Procter & Gamble and our friends at Suez, we've been able to create a supply chain that solves this by collecting it from all these locations all across the world and recycling it into a high-performance plastic that ends up in the Head & Shoulders bottle, making it the world's first recyclable shampoo bottle made 25% from beach plastic.
The Beach Plastic Project is something that really gives inspiration to people all over the world to take their responsibility seriously, as we do, and to recycle plastic and make sure it doesn't end up out here in nature in these beautiful places.
Together, these solutions illustrate how people around the world are improving the health of the planet and the communities they live in. The 2017 Planetary Health Lighthouse activities, shining a light to show that there's momentum for change for good.